Hi guys, we're back again, and as promised, we come back with a video covering how to go about doing the PLAB. This is something that a lot of our subscribers and viewers have reached out and asked us to share our experiences and thoughts. Now, while we've not done the PLAB ourselves, we found someone who's done it and is more than happy to share their experiences with it. It's Anirudh, Aditya, me, and we have a special guest who will be talking about the PLAB today.
Hi, Kanch. I'm Aprajita, and I did my undergraduation from India, from MR Medical College, Gulbarga. Then I went on to do my diploma in ophthalmic medicine and surgery from CMC Ludhiana. And after that, I did my DNB in ophthalmology. And then I moved directly to the UK with Anirudh. And so basically, I was supposed to start working right away, but there was a roadblock. And then I had to take a PLAB exams, and how things went. So
The regular teething problems of changing countries and healthcare systems, I guess.
So, but I've been lucky enough, and I got the dates, and I got a job also recently. I'm working as a specialty doctor in ophthalmology at Worcester, and yeah, things have been good now.
Nice. So you will be the star of the show. We will just be putting on some of the questions that we've been receiving, and just share your experiences on what's worked for you. How did you go about doing it? I know you've had to do it in a very limited time, and managing moving places and doing stuff. And I think uh, most of us doctors who at some point are giving the PLAB are dealing with a lot of these things, and they can probably do with the tips and tricks that you can share on what really helped crack that exam. So just to make it easier for everyone, these are the things that we will be covering today. These are some of the points. So we'll be covering on getting started with the PLAB. What is the PLAB exam actually? What level should you take it, and where do you start with it in the UK once you've taken the PLAB? The prerequisites and the validity of the IELTS or the OAT for the PLAB 1, the PLAB 2, and how the PLAB is now about to retire and is going to be taken up by something called the UKMLA. And we'll also talk a little bit about what to do once you've passed the PLAB. That's going to be the general theme of today's video, and hopefully this covers most of the points. And if there's anything that any of you guys want, put a question down and we'll try and answer that as well.
Yeah, so I think we'll start off with asking Aprajita, what exactly is a PLAB exam, and what does it help with, basically?
Yeah, so basically PLAB, as it stands for the Professional and Linguistic Assessments, and it is an exam that you can take straight away during your internship or after finishing off your internship. And it's more about how you see the patients in the UK than how your knowledge is, in the medical field overall. Because most of us, we get worried thinking about because it's an exam that you have to take in a different country and how things would be. But yeah, but it's more about how you interact with the patient, and yeah, more so.
So do you think that's more because of how the questions are or how the pattern of the exam itself is?
Yeah. So basically PLAB has two parts. Part one is more of an MCQ based exam, which every question has 5 options to it, and it's not a very difficult exam, especially if you've prepared for the Indian PG exams. You'll find them very easy. And but they have few sections which are a little difficult when it comes to us, because they involve the ethical scenarios and some psychiatry based stations, which are a little bit difficult as compared to how we see in India. So it's just getting to know how things are, and there are a lot of these coaching institutes, I would say, that help you prepare for them, and it doesn't take too long. Honestly, it's quite easy.
Okay, so what do you need before you even start taking the PLAB exam? Are there any requirements before you take the exam?
Yeah, so the prerequisite to be able to sit for the PLAB 1 examination is that you need to have either IELTS or the OET certificate, which is, I'm not sure about the OET, but for the IELTS, you need to have a minimum of 7.5 score. And
Is that overall or in each section?
overall 7.5.
Okay.
And I'm not sure how it is in each section because I took it about 2 years back. So
Yeah, if
Okay, but
I
the
remember
score that you
correctly,
want is 7.5, right?
yeah. So I think you want an overall band of 7.5, and
Mhm.
you shouldn't score less than 7 in any of the sections.
That's the
So
standard.
that's how it, yeah, that's how it works with the IELTS. Again, I haven't taken the OET, so wouldn't be able to comment on that. So yeah, I think so. Before you even start taking the PLAB, I think you need your English requirement sorted. And then how about the?
Can I just ask, does it have to be the UKVI academic IELTS exam, or can it be the just the general IELTS, the other one?
anything like not
It has.
particularly KVI.
I think it has to be the academic version, as far as I know.
We can put that in the link below.
Yeah. So, and especially regarding now with the coronavirus situation, because people are struggling to get dates for exams. How is that making it difficult for people who have passed the IELTS quite some time ago?
Right. So basically, there are no dates for 2021 as of now for PLAB 1 or PLAB 2. So even if
Wow.
you want to take up the exam, you can in 2022 now. You will be able to only start from January. I'm not even sure if it will be January or later on. So
And are there last minute cancellations of seats that open up? Is there, or does that generally not happen much with the PLAB because it's so much in demand?
not so much with the PLAB 1 because PLAB 1 is conducted throughout the world, I guess, because even India and Pakistan are the centers for PLAB 1. But yeah,
Okay.
PLAB 2, a lot of cancellations happen for PLAB 2 because it is conducted only in the UK. And because many countries are in the red list now. So
Okay.
a lot of cancellations.
Well, that is something which is in no one's hands and it goes as it goes.
But
But
that is how I got to take the exam actually. It's because of the
did you have to isolate before taking the exam? Did you come in and isolate and then sit for the exam, or?
So basically, I was in the UK, and so I didn't have to isolate myself. But if someone is coming from the outside, and then they have to, depending on the guidelines, that they have to either isolate or be in quarantine, and then only they can step out and do whatever they want.
Fair.
Yeah, I think an important point is that the validity of the IELTS and OET is just for 2 years. So you have to complete the process of PLAB 1, PLAB 2, and your GMC registration in 2 years' time
It's been
from the date that you've taken.
years. I'm so sorry, but it's recently, just this month, it's been extended to 3 years now because of the whole chaos that was created because of the COVID situation.
That's very kind of them. They've given us 1 more year.
Actually.
Right. So we'll get on to how to preparing for the exam. How did you prepare for PLAB 1, and how would you suggest others prepare for the
And also
exam?
do share, I know you mentioned that the situation was because of the pandemic, you came around giving it. Give us a little bit of insight on how it really came about. And I'm sure people would love to understand that part as well.
Right. So I had my MRCS and I was supposed to get the registration with my MRCS in ophthalmology. But during the lockdown last year in the month of March, it was announced by GMC that they will not be considering MRCS specifically in ophthalmology for the registration process. So it was kind of a roadblock for me because I had to either take FRCS or something else. I wasn't even aware at that point in time if I was eligible to take PLAB exams. Yeah.
Okay.
Such was my knowledge about PLAB. I thought it was something that could be taken only straight after your internship. And but I came across one of my friends who told me that she took PLAB exam last few years back actually, and it was a lot easier to go with than to go with the FRCS exam, which are a lot more tough.
Fair.
Yes. So basically, yeah, I got to know about it. Then I discussed with Anirudh whether I should take it or not. Of course, have your own fears and, because the questions, they come straight from your MBBS books, and it had been a lot of time for me since I had, looked back at them.
So once you registered, how did you go about preparing for it?
I had my IELTS already with me, my IELTS score. So it was only when I tried to look up for a PLAB 1 date, I realized that you need to have a valid IELTS score for that. Okay, so honestly, I was lucky enough to get registered and find a date for myself. But there was just one date available in Edinburgh, and I didn't even know at that point in time that there was such shortage of dates for Lab 1 because of the COVID situation. But thankfully, I could do that, and I did that about 1 month before the test. And yes, and yes, and then I took the test, and luckily I passed. And then there was another
At what, yeah, at what point did you start your preparation? Was it just after booking the test, or had you started preparing for PLAB Part 1 much earlier in terms of how did you go about your preparation? What did you read? Anything specific, any specific website, or any tips for people who want to prepare? And how long do you think it will take for them to prepare?
Right. So for me, I only started preparing 3 weeks before the exam. Even when I registered, I was kind of double-minded, and I was still thinking, what should I do about it? And I was trying to figure out the sources that I should go through to be able to, take the exam seriously. But so I came across these a lot of sources and academies. There's this group specifically for PLAB takers, and it's called PLAB on Facebook. And I kind of joined that group, and then also talked to a few of the people who had taken PLAB in the past, and few of my friends, and they told me there's a question bank which apparently is very helpful. I never went through it, but there's a question bank of about 1700 questions, and most of the questions apparently are based on that pattern, and it really helps you to understand the PLAB pattern. But they are very they're quite mixed up, the question bank. I had a look at it and realized that it wasn't possible for me to go through it in just 3 weeks. And because also I had forgotten a lot of pediatrics and emergency medicine and gynecology, and
How did you use those 3 weeks then? I know you probably possibly cannot go through 1700 questions in 3 weeks. How did you optimize your time?
Right, I didn't go through the question bank at all. Just for the viewers to know that there is a question bank, I'm letting them know. There are a lot of academies that help you with the PLAB 1 exam. So I joined one of them, and they're just there online. And I joined PLABable Academy, and which was 3 weeks before the exam. And it has an app also. Basically, this online forum, it offers you questions. There are about 50 to 60 to maybe 100 questions in each category, which would involve either emergency medicine or pediatrics, gynecology, cardiology, and everything like that. And so I went through the questions. I couldn't complete them honestly because it's impossible. 3 weeks is a really short time. But I guess I had prepared quite well for my PG exam. So I somehow could get through. But ideally, I would say you should keep at least 2 to 3 months in your hand to prepare for these. And as you go on that forum on Facebook, the PLAB forum, so you'll find that there are a lot of other academies also, like MedRevision and the PLAB version and academies like these. And normally people join all of them, and they prepare for at least 6 to 8 months or maybe a year for PLAB 1. And because I may be saying that it was easy for me, but for somebody who's new and who's just started preparing, it might not be so easy for them. Like I was honestly, I was shooting bricks with cardiology questions. I was literally in tears, and I didn't know anything about the ECG. But then you do get these questions, and you have to be prepared for them to be able to crack the exam. Mostly the passing marks is about 66 to 70%.
Okay.
So you have to
At this stage, I think when people are searching for dates, if they're starting to prepare now, they'll easily get a year's time to prepare for part 1 anyway. Moving beyond, so once you've done your PLAB 1, what about PLAB 2? How did you go around preparing for the next part?
Yeah, for the next part I found was a bit more difficult than the first part. because there you have to actually talk to patients who it's
That's
a
where the
basic,
communication aspect comes in.
exactly, it's a simulated environment with actors, and there are about, during COVID times, there are about 16 stations that you need to go through, and otherwise normally there used to be 18 before.
And do they actually have real patients and real people in, or are these, are you reading off a question stem of a piece of paper?
No, they're actual people inside. They're
Okay.
small cabins, and
Okay.
actual people inside, and some
So
of
you
them
rotate through each station one by one, I'm guessing.
and you get just 8 minutes for a station, and you have to finish off that station starting from the history taking to the management, and you have to finish it off.
And what kind of, what kind of stations are they? Are they diagnostic? Are they examination oriented? Are they knowledge based, or a bit of everything, to be fair?
Yeah, a bit of everything actually. Yeah.
So do you
And
get set time to perform a task and then questions, or is it just 8 minutes through and through?
yeah, so it's 8 minutes through and through, and it's about how you divide your own time
Okay.
to
Okay.
complete those tasks. And when you're preparing for PLAB 2, you eventually learn how to, and you need to crack basically how to get about those stations in 8 minutes. And it's mostly about talking and acting, and more than showing off your knowledge over there. So
How do you go about preparing for this? Because it's very different from the usual exam pattern that we are used to back in India. It sounds more like a OSCE/practical exam.
it is an OSCE actually. So
What helped you prepare? Did you find someone to practice with, or was it a mirror?
not mirror, but I was lucky enough to find a group, a WhatsApp group where I was added, and this group, they started practicing every night for 2 hours, and where you used to get chance maybe twice a week to present a scenario or something like that. And I joined the group because I had no clue about PLAB 2, and I think it was that group actually that helped me pass the exam, because the people from all over the world, and they had quite a good idea about PLAB 2, and they were quite knowledgeable also, probably because they had prepared really well for PLAB 1, unlike me. And so they knew.
How would you suggest people normally, I mean, your circumstances were different, but how would you suggest people normally prepare for PLAB 2? Are there academies, or what would you suggest?
Right. So there are a lot of academies that are based in Manchester and London that you can join. And during the COVID times, they're actually offering online classes, and they have these PDF versions of the scenarios and the conversations that you have with the patient. And you can go through it if you want to, but my suggestion would be to stay natural and not try to learn how to, basically it's about speaking English and the right way, and being empathetic and showing this sympathy. And now that I'm working in the UK, I realize that it's actually like that. This is how patients talk here in the UK, and it's a quite a good simulated environment.
I do think that there are certain set scenarios which require the examinee to give certain answers in a certain way, and I think it is sometimes useful for people to go through what the ideal answers are, so that it gives them an idea, as to how to communicate, especially if they've not worked in the UK before. For interns in India, if they go through that, then that's something useful. But other than that, is there any PLAB 2 service that people in India can get within India, or is it, or do they just have to rely on in UK based?
Quite sure whether they're available within India. There's an academy known as Aspire Academy, which is based in Manchester and which is run by Indians.
Okay.
But I don't know if they have their classes running in India.
I do know that there are certain YouTube videos as well that people have done to try and touch up on how to go about, especially preparing for the part 2 of the PLAB, and how to help them get oriented to the communication aspect of it, because that is one thing I think a lot of us can find ourselves caught out on, being able, because I think we tend to think in our native language, and then we tend to translate and express, which is where we lose a little bit of time. I mean, it's a fact. And when you have an 8-minute window to display your knowledge and information, you have to be very adept at doing it.
Bottom line for any examination in the UK, whether it is MRCS or PLAB, is that they test whether you're a safe doctor or not. And once you understand those concepts of being safe, you tend to pick up on a theme of how to answer certain questions in a certain way.
Yeah, and I think want to mention that ethical scenarios, especially, are something that we in India don't normally get exposed to during our training, and these form an important aspect of both the PLAB 1 and the PLAB 2 exams. So that's something that we need to.
Aprajita, is there a way you went about preparing for these ethical questions, or this aspect?
These ethical scenarios and psychiatry are particularly very important for both PLAB 1 and PLAB 2, because this is something that we don't learn in India, and they are very specific to UK. And so I was basically practicing with this group, and I think practicing is the most important thing to do if you want to crack PLAB 2. But then there are also a few stations, as you said, about examination techniques, and there are mannequins, and there's a Simmons station, which is always there. So it's basically a toy human, a really huge toy human who can talk, and
Oh, wow.
you can actually hear the heartbeats and the breath sounds and check the pulses and everything, and then you have to talk to them and also figure out what they have, and there's also an examiner sitting. So basically in the last 2 minutes, basically you have 6 minutes to examine, and then the last 2 minutes to talk about how you're going to manage this case and what you're going to do about it.
Fair. So I think you've given us a very nice idea of what the PLAB 1, PLAB 2 is about. And as a quick summary, PLAB 1, I think it's the MCQs, use the material that's available, try and do as many questions as you can, and give it about 3 to 4 months, you'd say?
Yeah.
And PLAB 2, again, try and practice with as many people as you can, examination techniques, communication, this as per any OSCE exam. There's this new thing that's come in, which is the UKMLA. So can you shed some light on how the PLAB is now moving towards the UKMLA, and what people who are planning to give it in the next year or two, or so on and so forth, how does it impact them?
So basically PLAB is going to vanish slowly, and by 2024 UKMLA, which is on similar patterns as UKMLE, it will come in, and this is an exam which will have to be taken by both UK undergraduates as well as an international medical graduate. And so I don't know how the pattern would be, because even the USMLE pattern has changed recently, and I guess the clinical skill has been taken off. So that is something I can comment on. But
it comes in 2024, is that correct?
I think it's a tentative, but
okay. Obviously, with the pandemic, things are dates might change.
At the moment, with regards to UKMLA, I think the GMC website would be the best place to find the latest and the most accurate information with regards to that. But it's a few years before it will come in. But until then, I think we have to stick to PLAB. People have to give that exam. But the most important message, I think, for people to understand, in my opinion, is that PLAB essentially is your pathway to GMC registration, no matter what level you are at. Obviously, the easiest and the best time, if you want to move on to the UK earlier in your career rather than later, is probably an intern level. Or afterwards, of course, depending on your circumstances. But a PLAB does not guarantee a job. It guarantees GMC registration, which is a prerequisite for a job. And the kind of job that you would get or that you would be apply for would depend on your CV or your interest. Being an intern gives you an advantage that you can apply in different kinds of fields of different subspecialties, or as an FY doctor, you can just come as an F2 doctor and find out where you want to go.
So once you've cleared your PLAB, what's the next step? At what level do you start in the the long hierarchy of medicine career?
Right, in the UK. So as soon as you're done with your PLAB 2, you can apply for the GMC registration, which takes about 6 weeks, and you can keep applying for the jobs even when you don't have a registration, I guess, just to get an idea what kind of jobs you can apply for on those websites.
So would that be a CT, a core trainee, or a core medical trainee level job, or would that be a specialist trainee?
So that will depend on the experience that you have.
Okay.
So if you've just been through your internship, then obviously you would be applying for an SHO or CT or FY job. But
So a post intern would apply for a CT1 job, I think. Correct me if I'm wrong.
Yeah, I mean, there are different terminologies to those jobs. Essentially, foundation year, core trainee, or SHO jobs. I mean, there's a lot of different wording that is used in advertising these jobs, but essentially at the level below, a registrar. So all of those jobs, I think you'll be able to apply to as if you're a
interns in India do only a year of internship, whereas they do 2 years in the UK. So if you're fresh, if you just completed your internship without any further experience, by default, the joining level will be an FI2, where you have to complete your FI2 and get signed off with your ARCPs at that level. Once you've done that, then you can move on to the CT or the SHO level jobs. However, if you've got more experience after your internship in terms of different jobs in India, whether it be PG or non-CAD JR-ship in a certain department, then probably you could apply for SHO level or higher level jobs depending on the CV. Correct me if I'm wrong, Aprajita.
no, I think you're right. You're definitely right. Yeah.
Brilliant. So I think we've covered most of the basics that we'd like to. You've given us a very fair idea of how to go about it, and you've kind of showed that it is very doable as well, even when the odds are stacked against you. And obviously, if you have more time and you can be a little well prepared, so you probably go in feeling a little more confident. But I think one of the biggest lessons that we can see from your journey is that it can be done. It's not impossible, even when the odds are against you.
Yeah. It's very much doable.
Brilliant. I know talking about the PLAB is something which can probably go on for hours. We try and keep our videos very goal oriented, and I'm sure there's many questions that people would have. Please feel free to put the questions down. You know where to reach us. You can send us an email on the email address below. Leave us a comment, share, subscribe, and we will try our best to get back to you as soon as possible. Anything from you side, Aditya, Anirudh, Prajita?
No, I think we covered pretty much.
Covered everything, and I'd like to thank Aprajita for joining us and giving us a lot of insight with regards to PLAB. A lot of people have been asking a lot of questions, and this video should be helpful.
Thanks for having me, guys.
It's a pleasure. All right. Thank you, guys. Bye-bye.